Hi, trigger points are implicated in the vast majority of muscular pain cases. I have been asked by many, what exactly are trigger points and how to deal with them effectively? Well, this video is not intended to be an ultimate academic guide on trigger point therapy. It is not my intention to go into great depth on the referral patterns, identification, and treatment of all the possible trigger points that may be implicated in lower back pain cases. I'm merely attempting to explain to you what trigger points are and to highlight the diversity of symptoms that can be caused by trigger points so that you can look out for the involvement as a differential diagnosis in musculoskeletal and other discomfort, such as tendinitis or arthritis. Trigger points are implicated in approximately 75% to 95% of muscular pain cases, and inactivity is a major perpetuator. In recent years, technology and automation have reduced the amount of physical activities being undertaken. People are generally more inactive than they used to be, and therefore, muscular pain cases, such as neck and back pain, have become more prevalent. The majority of lower back pain cases are caused by myofascial pain syndrome, which is characterized by chronic pain generated by either fascial constriction, that's what we call adhesion, or trigger points, which can appear anywhere in the body. Well, like trigger points, adhesion are a common cause of muscular pain. Adhesion are more about the fascial system than the muscular system. Fascia is a connective tissue that wraps and supports our organs, bones, and tendons. It is one continuous structure that exists from head to toe without interruption. In fact, each part of the entire body is connected to every other part by the fascial system. Where the fascia wrap muscles, it is known as myofascia. Myofascia is a scaffolding for muscles, keeping them separate or together when needed for movement. In a normal healthy state, fascia is viscoelastic and able to stretch and move without restriction. These factors can cause tightening of the once flexible structure. Microscopically, myofascia resembles a fishing net and is well organized and very flexible in a healthy state. However, during repair processes, it forms scar tissues, and when it gets stuck to other tissues, your muscles may feel as if they have been tied in knots, which can restrict the normal range of movements. Myofascia is like a complete bodysuit. It is continuous, and therefore damage to an area of fascia can affect other distant areas of your body, creating problems far away from the adhesion through compensation patterns, which can potentially affect your posture and movements. So self-myofascial release can directly change and improve the health of fascia. The objective of SMR is to break up scar tissue, increase circulation, and help to remove toxic metabolic waste that have been restricted by the contracted tissue. Deep tissue massage carried out by your therapist can be performed at home by yourself using devices such as foam rollers. Besides muscle tightness being caused by the formation of scar tissue during the repair processes of myofascia, trigger points that are formed within muscles can also make muscles tight and restrict their movements. Trigger points are in fact a small patch of tightly contracted muscles, an isolated spasm affected just an individual muscle fiber. The body's neuromuscular system can easily be adversely affected by poor posture, repetitive muscle strain, or dysfunctional movements. These mechanically stressful actions are recognized as an injury by the body, initiating a repair process called the cumulative injury cycle, which follows a pathway of inflammation, and the development of fascial adhesion and trigger points that can lead to reduction in muscular elasticity. Self-myofascial release focuses on alleviating these adhesions and trigger points to restore optimal muscle function. Although the acute phase of back pain typically subsides within a week or so, even without treatment, many suffer from recurrent symptoms. And this is because without treatment, trigger points simply turn latent and can be reactivated with the slightest overload, for example, by twisting or bending awkwardly. Trigger points often cause symptoms that mimic common medical conditions. This is because muscles that have been tightened by trigger points frequently compress nearby nerves, resulting in altered sensations including numbness, dizziness, itchiness, burning, heat, or hypersensitivity in the area supplied by the nerve. Trigger points are known to cause headache, neck pain, and lower back pain, and many types of joint pain are often mistakenly ascribed to arthritis, tendinitis, bursitis, or ligament injuries. They can cause problems as diverse as earache, dizziness, nausea, heartburn, false anginal pain, tennis or golfer's elbow, tension headache, facial pain, sinus pain, and even toothache. They can be responsible for chronic pain and disability that seems to have no means of relief, which can ultimately result in depression. They are also treatable causes of range of motion loss, muscle weakness, pain, and other symptoms often blamed on old age. When investigating back pain, trigger points should be at the top of the list because it has been estimated that in 75 to 95% of muscular pain cases, trigger points are a primary cause. Unfortunately, doctors may not be fully aware of trigger points. Misdiagnosis of such a simple source of musculoskeletal problem can lead to unnecessary invasive treatment. We all have trigger points. The question is the degree to which they affect us. They can exist indefinitely in a latent state until intervention occurs. These trigger points accumulate over a lifetime and appear to be the main cause of stiff joints and the restriction of a range of movements. They can also keep muscles out of balance, causing joints to click during function. Trigger points, either active or latent, are easy to locate because they are always very painful when pressed on. It is important to realize that the level of pain depends more on the degree of trigger point irritability than the size of the muscle. Trigger points in the thinnest muscles, such as the piriformis of the glutes, can cause crippling lower back pain. The problem is that trigger points can refer pain to another site. Once you know where to look, however, they are easy to locate by touch and deactivated through SMR. The predictable referral patterns of various trigger points within various muscles are well documented. When you press on a trigger point, you should often be able to feel this pain spreading to the predictable refer site. Even when your back pain is due to genuine problems in your spine, trigger points may still be causing a major part of your pain. In fact, trigger points may actually be the root cause of many genuine spinal problems, such as a prolapse or herniated disc, because trigger points keep the host muscle short and tight. These can be the ultimate source of disc compression and spinal nerve impingement. In the next video, we're going to talk about the management of trigger points within the various muscles that are commonly implicated in lower back pain cases. Thank you for watching until the end. If you like this video, please click the like button. Please subscribe, share, and comment. Please also hit the bell so that you will be notified of any new future video release. If you're interested in improving your health and fitness, and if you want to prevent lower back pain, please take a look at my book, which is now available from Amazon. Thank you.